you earlier, what age should you bring your child to the dentist? If you have a young kid, how soon should you bring them to the dentist?
As soon as they have teeth. So,
what?
Yep, the American Academy of Pediatric Dentistry, AAPD, says as soon as they have teeth or within 6 months of that. So, usually by like age 1, they're starting to get teeth. It's not a visit like you and I have where there's tons of screaming.
Yeah, what do you do with a 1-year-old infant that's breastfeeding, and then you bringing them they bringing the kids to the dentist? What do you do with them?
So honestly, what I'm doing mostly is just using like a regular toothbrush and toothpaste, brushing those teeth, and checking.
Like with a toothbrush?
Literally with a toothbrush and toothpaste.
So you're saying that parents should get there's infant toothbrushes on the market?
There are infant toothbrushes. When they bring them here though, I use just like a regular toothbrush with a really small head. It's a fun kid's toothbrush with like a panda bear on it or something. And I'm just brushing their teeth and checking everything as I'm brushing their teeth. And just getting them used to coming to the dentist.
And so you would obviously like have the child's parent in the chair and the kid is in the lap.
Kind of sit across from each other like knee to knee and then lay the child's head back into my lap and we do it that way.
And how often is it that the kid is just not cooperative?
I mean, if they're 1 or 2, they're gonna cry and scream. But as soon as they sit up, they're like, oh, okay.
That was nothing.
And they go watch TV and get a sticker and they're perfectly fine.
Is it true that the recommendation is you should start flossing as soon as 2 teeth touch? Is that true?
Exactly. That's what
so that means when the child is like 1 or 2, they should be flossing the teeth?
So with those little flossers, flossing isn't age-based. It's just wherever, if teeth are touching, you need to floss to get the chocolate and the candy and the raisins out of
I bet you guys didn't know that because half of you adults out there don't floss. If you have a child and they have 2 teeth that are touching, guess what needs to go between those teeth to prevent cavities? Floss. And then known as bottle rot. Yes, where does that come from? Where does the bottle rot or baby bottle cavities come from?
From putting kids to sleep with a bottle of something other than water. Juice, milk, regular milk, chocolate milk, pop, iced tea. Around here, Mountain Dew.
Oh, is that the thing?
It's a thing. It's a thing.
So what, if the parents want to kind of soothe the child, put them to sleep, then what should they put the child to sleep with?
Honestly, if you can warm or like lukewarm water, that's going to be your best bet. But I know, boring. But here's the thing, you can do a little bit of milk, but if you're going to do that, you absolutely need to at least take a washcloth or a gauze
and wipe the teeth.
And wipe the teeth off.
What you don't want is for the milk or sugary substance to marinate on the teeth all night. Disaster for cavities.
Exactly. Because we all know kids aren't the best about letting you get in there and brush anyway. So then that's sitting on there all night and
What are your thoughts on fluoride? I get this question all the time. Are you an anti-fluoride or a fluoride person?
I'm a fluoride person.
Me too. Y'all better not listen to those reports. Y'all better get some fluoride in your toothpaste, in your mouth rinse, or your kid's gonna have cavities. Especially if you don't live in a fluoridated water area.
Exactly.
Your child is in trouble.
Here's what I tell people. With fluoride, it's not 100% guarantee that they won't get cavities, but the ones that I see that have the most cavities, I can almost guarantee you
they don't have fluoride. Yeah.
Yep. Exactly.
So would you recommend you like ACT?
I love ACT fluoride mouth rinse. Obviously, if they're young, make sure they're not just guzzling.
Right.
Here's the thing with the whole fluoride thing. There has never, ever, ever been a scientific study that shows that it causes any of these issues that people are talking about.
It's a poison.
No.
It's a poison. You're poisoning.
It's never been shown in humans. So just like anything, any type of medicine, anything out there, vitamins, you can have too much of a good thing.
That is true.
Just like anything.
Sugar,
you can have too much, technically you can have too much water.
I think sugar is the biggest poison on the market right now.
Exactly.
How about that?
Yep.
And when Bloomberg tried to count the sugar in the supersizing of the drinks, y'all New Yorkers were like, no. So go ahead and supersize, because that's what keeps us in business. Keep on drinking your supersized drinks and all of that stuff.
Yep.
What else? What are some of the other myths that you get.
Let's see that the kids don't need to come until they're like 6 or 7. By then you could have 20 cavities.
Nurse Noelle, she's a nurse in New York City. She says that you got to prevent those horrible silver caps. So kids can have the need for root canals, and kids can get crowns on their baby teeth. That happens when that's usually just like pure neglect, right?
It can be neglect, but also just my kid cries when I brush their teeth, and then you stop brushing their teeth.
What do you do? Yeah, what do you do when the kid is just giving you, hey Eric, giving you the blues about brushing?
You know what? Kids are gonna cry and scream about things that they don't want to do, but that's why you're the parent and they're the kid.
Don't let these kids.
You have to do it.
Okay, here's a big one. Thumb sucking. If you have someone that's sucking their thumb and they're getting of age, do you expect it like with young kids?
Yeah, absolutely. It's a soothing mechanism to an extent. Yeah.
And so how do you break the habit?
So a lot of kids actually, if they're still sucking their thumb into like kindergarten, whatnot, a lot of times they'll stop kind of on their own once they get to school years and they see like they're around their friends. They don't want that to happen. But worst comes to worst, there are actually orthodontic appliances that can stop them from getting the thumb in there, or just putting something nasty tasting on their thumbs. That helps too.
So you could put like a cage in there or something?
Yep.
Jesus Christ.
A cage or a crib or a rake or something like that. Yep.
And that usually works?
That usually works.
Wow.
That's our last resort.
How much does something like that cost?
It really depends. I mean, it could be a couple $100
Okay.
Easily. Yeah.
Okay.
That's the tough part. Pacifiers you can just throw away. Thumbs, not so much.
Now, what age would you consider someone for braces?
So we really start looking at that at about 8 or so. I really start checking, not necessarily age-wise, but if they have all 4 of their adult bottom middle teeth and all 4 of their adult top middle teeth, then I start really look. That gives me a good idea of where things are going to lie.
So if the 4 upper and lower teeth are coming in crooked, that's a sign that there's some problems?
It can be a sign that there's some problems.
Okay.
And that's when we take that big panoramic x-ray.
And it goes around your head.
Yep, exactly.
And that shows like your jaw structure and where the baby teeth are in
where
relation
the adult teeth are growing up in here, if they're going to be smushed and crowded, if you look like you have enough space, if it looks like you're crowded, we send you off to the orthodontist.
So is there an age that's too young to get braces? If you see a problem happening like early, really early?
It really depends. I've seen probably as young as like 6 having not necessarily full out braces, but some type of orthodontic appliance. If you see
6, that's like you're in 12th, first or first grade.
It depends. There's some really severely bad bites out there that are only going to get worse with age. So.
Man.
But it also depends on the child's cooperation.
Right.
So, yeah.
Well, wow. It's been such an honor to visit you in your office in Pittsburgh. We will be back. We're going to go fellowship, have a little, drink and have a little bite. And then we will be back. This is not going to be my last time visiting. I'm here till Thursday, so you never know. I may be back. I may be looking at some office space. Y'all are all wondering where the hell is Dr. Austin and where is she going to end up? It could be right next door in Pittsburgh. I kind of like it here. I do. Oh, look at here. My battery is getting low. You iPhone. I know you want me to upgrade to like the 9 or 10. No, I'm not going to fall for your trick, iPhone. Okay. All right, Dr. Erin. Y'all, you know what? Follow. This is where you're going to go. Follow her on Instagram. Do you have a Facebook too?
Yeah, it's Winning Smiles Pediatric Dental Care.
Okay. Look up Winning Smiles Pediatric Dental Care in your Facebook search. And then Instagram, Dr._Erin.
Yay.
I'm out, live from Pittsburgh, Pennsylvania, coming to a city near you. LA, you got next. Amsterdam, you got next. Boston, you got next. I'm in these streets across the United States, bringing you the best in dentistry and life. Follow me. You don't want to miss this. Bye.
Bye.
Let me say bye. Okay, yeah, bye.
Bye, everybody.
All right.